The Omicron surge affecting school-age kids, not just in the number of positive cases reported across school campuses. There can also be a mental health impact on children. And KCRA 3's Melanie Wingo heard from the experts on how to talk with kids about their COVID anxiety.
2 weeks after winter break, most school-age kids are back in the classrooms, just as the Omicron surge may be affecting people they know.
Kids are more aware of the increased cases by having staff members in their school be gone, their friends being infected.
As COVID hits close to home, experts say it's important parents acknowledge the worries about the virus their kids may be expressing.
Is it just the anxiety of getting to the school? Is it the fear of being in a classroom and contracting it? Is it for some kids it actually might be the complete opposite? It's the fear of schools closing and going back to distance learning and not being able to participate in their activities.
Pediatricians and clinical psychologists explaining the mental health toll brought on by the pandemic isn't just affecting the adults. Anxiety may be affecting children too.
Sometimes the degree of anxiety is so heightened and so severe in these situations that it can almost paralyze kids and affect their ability to be able to attend school and, succeed in school.
When kids kind of start imagining the worst might happen, it kind of takes on a life of its own.
In those instances, doctors suggest helping them understand the public health measures they're seeing, which can be comforting to kids.
The idea of, you're helping by doing this test. We know it's not very fun, but this is going to help schools stay open. This is going to help your friends stay well. And this is going to help you if we need to get you to the doctor.
Keeping the messaging positive versus alarming is a good approach.
Bringing them down to earth, but supporting them is the balance that I want to encourage folks to find.
Reminding children that we know so much more now about how to protect ourselves from the virus and the ways your family is taking precautions to keep them safe may help too.
I think professional help is important, but I also want people to know that they have an ability to really intervene in these things, especially if they do it early.
Melanie Wingo, KCRA 3 News.
And doctors also say that anxiety is very treatable, and they suggest asking your healthcare provider for help if you notice any changes in your child's behavior or mood, if they're irritable or withdrawn or experience sleep disruption.